welcome once again to another session with Precious, health session with Precious. And today I'll be taking you all on a very interesting topic today, how to lower the risk of high blood pressure or blood pressure. And what is high blood pressure? High blood pressure or hypertension, like we usually call it, is a silent killer. It's usually called a silent killer because it doesn't have any symptoms and it's usually a risk factor for heart problems, stroke, and even death. Now, we have to really look at check our blood pressure regularly to know when it's going above the normal and going and within normal range. Now, your blood pressure depends on how much blood is being pumped into the arteries and the amount of resistance or restriction that this blood is passing through in the arteries. That is, the narrower your arteries, the more the blood pressure. That is, the more pressure that will be exerted on the arteries while the blood is being pumped. Blood pressure is usually measured in millimeters of mercury. So the normal blood pressure, the normal range, blood pressure of less than 120/80 mmHg, that's millimeters of mercury, is considered to be normal. But once it goes above or equal to 130/80 millimeters of mercury, it is considered to be high. Now, if your blood pressure is above normal, but under that 130/80, you have elevated blood pressure, and you are also at risk of developing high blood pressure. Now, within this range, you can easily manage it just by changing your lifestyles and doing the necessary things without actually taking medications. You can lower the blood pressure. Now, what are the steps you can take to lower your blood pressure? First of all, increase exercise, increase activity, especially aerobic exercises. It helps to lower the blood pressure. Once you keep increasing your heart rate, the breathing rates of the heart, with time, the heart gets stronger and makes it easier for it to pump blood. So increase activity like walking, riding, using the stairs. Little exercises can help increase the activity of the heart, thereby making it stronger and thereby lowering the blood pressure. The second one is lose weight. If you are overweight, you have to lose weight. Obesity or overweight increases blood pressure. Another way also is to reduce the intake of sugar or refined carbohydrates. This causes high blood pressure. That increases the blood pressure. So you have to reduce your intake of sugar or refined carbohydrates. Another one is eat more of potassium and less of sodium. That's eat potassium-giving foods, food that contain potassium in large quantities, like milk, yogurt, fish, fruits, and not just any fruits, bananas, avocados, oranges. These contain potassium in high quantities. And also vegetables, like sweet potatoes, tomatoes, green, etc. Because potassium is a very, very important mineral in the body. It helps reduce the effect of sodium found in salt. So we have to take more of potassium-giving foods and also reduce the intake of processed food like pizza, chips, etc. Please, very important. Also, stop smoking. Smoking is very harmful to the body. It can cause an immediate temporary increase in blood pressure. And this is very, very bad over the time. Chemicals in tobacco. Those chemicals we find in tobacco, they damage the blood vessel walls, causing inflammation, narrowing, and hardening of the arteries, which result in high blood pressure. Please reduce your smoking. Stop smoking, in fact. Don't even reduce. Stop. And also, reduce excess stress. Try to reduce stress. We know daily work activities, different activities can cause us stress, but we have to try in our own way. Do things that actually relieve you of stress, like taking a walk, reading a book. Yes, if you know you like reading, usually engage in reading a book. It's really, really good. And also watching movies, especially comedy, to take the stress off of you is very important to lower your blood pressure. And also make sure you get enough sleep. Sleep is very important to rest the body, the organs of the body, especially the brain. It helps reduce every pressure on the body. And also eat healthy. Eat healthy food is very, very important. Food rich in protein helps so much. Yes, food like fish, egg, beef, poultry, especially chicken breast, it helps so much. Beans, nuts, this food help you lower your blood pressure and drink less alcohol. It's very important. You have to drink less alcohol to reduce your blood pressure. Now, if after taking these steps and your blood pressure doesn't reduce, consult your doctor. He could recommend prescription drugs that might help you best in lowering your blood pressure. Now we know various things can cause this blood pressure: genetics, poor diet, stress, alcohol, lack of exercise. And I've said it: exercise more, increase your activity, eat very well, reduce the intake of alcohol, take the right diet, try to relieve your stress whatever way suits you. It's very important. And do these things, and you'll be able to lower your blood pressure. And remember, certain medications you take can cause high blood pressure. So please mind how you take medications. Take medications according to your doctor's prescriptions. It's very important. Don't do self-medication. It's not good. So thank you so much for watching, and I hope you enjoyed today's session. Yes. Don't forget to like, subscribe to this channel. Please and please subscribe to this channel. Don't forget, so you don't miss out on other sessions like this. And once again, I'm your anchor, Precious.